Good morning and welcome to Superfood Supermornings with Dr. Shilpi. So it was all about superfoods the entire last month, and this is World Nutrition Week, and we are dealing with a problem of PCOD. So it's another month for PCOD awareness, but yet there's a social topic that I wanted to cover, which is all about nutrition and associated with nutrition. So today we're going to talk about the safety of coffee and caffeine products in pregnancy, and also for people who are planning pregnancy and lactating mothers. So this topic I chose with regard to the latest guidelines and latest studies that have come up a week or 10 days back, done by European Society of Human Reproduction. And I wanted to update everybody about this study, which is a meta-analysis. That means they have done research over 20 years, that is 2 decades, and they have done at multiple places, say about 48 studies, and they have analyzed every study and they have given this output. And why I wanted to talk about this is because everybody thinks that coffee is safe. 1 or 2 cups of coffee is okay for everybody, but then as such, caffeine has its own advantages and disadvantages. I wanted to take the message very clear that it is very important to see it with a different angle for pregnant, pre-pregnancy or pregnancy planning women and lactating mothers. So this is about a study of so many meta-analysis of 48 studies and 2 decades of information. It was done by Dr. Jack James from Reykjavik University, Iceland, and the study was just released a couple of days back. And in this study, they have clearly mentioned that there is no safe level of caffeine consumption for pregnant women and also would-be mothers. So if you can understand this line, that there is no safe level of caffeine consumption for pregnant women and would-be mothers. This is a compilation of so many observational studies and review findings, and they have concluded that maternal caffeine consumption has a link with adverse outcomes in pregnancy. Now, what does this mean? This means that people who take coffee or caffeine or any products that are related to caffeine, it can be 0-calorie drinks, it can be, products like Red Bull, or it can be any products that are loaded with caffeine. There are at times products loaded with caffeine in chocolates, in desserts. There are so many other forms of caffeine that we have, and especially one of the most commonest cause of commonest form of caffeine is definitely coffee. So we're going to initialize the discussion and direct it towards the coffee, and for example, I will tell you the safe level previously. We had safe levels that are associated with coffee till recently also, and the safe level was set for about 200 mg of caffeine, which is 2 cups of coffee per day of a moderate strength coffee. Now, if moderate strength coffee is about 100 mg per day per cup, so about 2 cups were set as an okay level till date for pregnant women. Even when people used to ask us, Madam, can I have coffee? Can I have my tea in my OPD? Especially for people who are planning pregnancy and people who were talking about early pregnancy and pregnancy, I have a habit of having coffee. What do you say, doctor? Can we have coffee or not? Then we also used to say that restrict the amount of intake, and also get it to a level which is the minimum, maybe a cup or so, just in case if you are having headaches and you're not having your daily routine without it. But then now it has become very important after this study that the message goes very clear, because people come to you to look for the latest updates and the latest guidelines, so that this kind of a science and research makes a difference in your life. And this is what, as a doctor, I have to convey to my patients who trust me and come to me. And after these observational studies, they have clearly said that anybody who is planning pregnancy, who is pregnant or lactating mothers, definitely should avoid caffeine. And this also applies to people who are trying to conceive also. And when this is in view of considering very good outcomes of a safe pregnancy and a term delivery. That means anybody who is wanting to have a safe pregnancy and a full term delivery should have restricted coffee intake, whatsoever means it is, and restricted caffeine intake. For some people, they have a habit of having high caffeinated beverages of 0 calorie value. They always think that it is 0 calorie, so I can take in this kind of drink for just adding on to my work pressure, relaxation and all these things. But yes, such drinks are also supposed to be avoided if you are contemplating a healthy pregnancy and a term delivery. Now, when we talk about what are the side effects of coffee or the caffeine per se, in pregnant women or in women who are contemplating pregnancy, especially when we talk about pregnant women, they have found association of coffee to 6 bad obstetric outcomes. Hi Pratibha, I know you're online. Thank you, and this message goes for you also. The European Society of Human Reproduction has given a study a couple of days back, and according to this study, these adverse outcomes, the 6 adverse outcomes associated with caffeine intake in pregnancy are: it can be a miscarriage, it can be a stillbirth, that means the heartbeat can stop inside the mother, and there can be low birth weight babies born. There can be a preterm delivery, and in early childhood, the chances of childhood leukemias were found to be little higher, and in future, the children could have a component of obesity and overweight. So these were the 6 associations that they found out when mothers had a lot of caffeine intake during pregnancy. And so coffee was studied last 20 years, and now they have come up with a study, and their association with higher incidence of miscarriage, higher incidence of stillbirth, higher incidence of low birth weight babies, preterm deliveries, higher incidence of childhood acute leukemias, and higher incidence of overweight and obese children were seen. And now, the current obstetrics and gynec societies, the UK, which is the NHS, which is the ACOG, which is the European Food Safety, associations. In the past, when they gave a restricted amount of caffeine intake, the coffee of 200 mg, now it is under review, and now they are also saying that there is no safe level and it has to be avoided. So avoid caffeine for all pregnant mothers and would-be mothers, and also who are contemplating pregnancy. So whatever. So Professor Jack James of this university had extensive study in the last 20 years, and he has found out, everybody knows that, and he has found out in this research study of 20 years that caffeine crosses placenta. So when caffeine crosses placenta, it goes to the same level approximately what is there in the mother. The same level is approximately there in the baby also. So what effects of caffeine, that the coffee that we are seeing in our bodies when we drink, will be the same effect in the babies also that are inside the mother. So fetal concentrations of caffeine were similar to the mother's, and what effect of caffeine that we have in us, like it constricts the cerebral and coronary blood vessels, it causes renal diuresis, it causes respiratory bronchodilation, it causes gastrointestinal acid secretions. So these kind of effects, what was seen in mothers, were also seen in the baby. And now all these things have come to a place that both we have theoretical explanations, we have empirical explanations, we can think that this can happen, that can happen, but then when you consider all these things together, the association with adverse outcomes was very strong. And now you can ask us that there are so many people who drink coffee. Now how about them? And in USA per se, just for example, because India, there is always a lack of statistics that happens. So it is important that we take statistics which are significantly compiled and analyzed and streamlined, and we talk about statistics which are already done. If we talk about a theoretical example, for example, in America, there are about 350,000, that is 3.5 lakh negative pregnancy outcomes every year, and these these can be a miscarriage, a stillbirth, a low birth weight, a small for gestational age, or any adverse outcome in these pregnant women. Now this can also be associated with coffee, because the entire nation there has lots and lots of coffee, and their daily routine runs on coffee. So now if we have to theoretically talk that if coffee is out, or if caffeine is out of the topic or out of pregnant women, now how many adverse outcomes can we prevent is what they have to check in. And even to do research now, see, this is all about the past that they have analyzed. That means last 20 years data they have analyzed, over 48 studies, and they have checked every little bit of that studies, and they have come to this conclusion. Now if we begin to do a study of comparing people having coffee and people not having coffee during pregnancy and the outcomes, this is again a very big ethical issue, which is definitely not possible, because if you have to think about ethical issues, you cannot give any pregnant woman that has been proven to do wrong to the pregnancy and the child and do experiments. So in the past, the studies, the data collected has been reflected in the study, but in future, to do a further research on this, how much ethical constraints we might have is a question, because now it is important that we take a message that to avoid caffeine, and there is no safe level for caffeine consumption for pregnant and would-be mothers. So this is about coffee today. And when we talk about such things, they are very sensitive issues, and we talk about documents, and we talk about research, and we talk about analysis. It is important that we take a clear-cut message, because it is an effort of scientists that they have given this kind of message, and we take it forward. But then who are having coffee on a regular basis, try to cut down, try to stop, try to look for alternatives. There are n number of our kitchen spices and our kitchen spice decoctions, and which are quite safe and which do not cause any issues. And it is important that the message has to be taken. And why I chose this topic for World Nutrition Week is, people think it's very casual to have coffee, and they always take it on the grounds of safety, and they think that it is safe for them to have a lesser intake of certain things when compared to a higher doses. But yes, now it's about coffee, and the research that I have told you, it's a single study. The documents are all available online, and you can go through them. And yet another food, I always spoke about what to eat in the last 1 month, but now I thought it as a social initiative that you should give information that gives more strength to the power of knowledge, that what is good and what is right has to be told, and it has to be a clear-cut message. And it is important that taking it forward, you should not give a one unilateral decision, but yes, it is important that we talk about certain things in a very authentic way. And there are so many of them watching. Hi Mahesh, hi Bhima, hi Nikhil, hi Murthy Garu, hi Parashuram, hi Suresh, and there are so many of them watching here at Insta. Hi Vikram, hi Bhagish, hi Madhuri, hi Hari Krishna, hi Shanu, hi Ravi, hi Rajvi, hi Pranesh, hi San, hi Harini, hi Vijay, good morning. And I love coffee at my friend's Vijay's place. And hi Funny, hi Priya, hi Anjanelu. So a very casual association of coffee has so many pros and cons to it, and it's very important that when you're offering coffee to anybody who's pregnant or planning pregnancy, just think twice and offer something else rather than something that is not very healthy, especially when it is proven it's not healthy. And yes, research is ongoing, and we have so many things to learn in future. So this is about Superfood Super Mornings, and we will touch base again Monday morning with yet another information and yet another topic, which is going to be very exciting. And wait for my Sunday message tomorrow. That is in the pipeline, and we will take questions if anybody has. Any questions? Yes, so if there are no questions, we will finish it for today. So bye, have a nice weekend, enjoy your Saturdays, and Saturdays are extremely busy for us. See, I am ready to go to the hospital because every minute counts on a Saturday, and we get extremely tired by the end of the day. Bye.